Hello, I'm Scott, and I'm here to tell you a little bit more about diabetes. Diabetes is the condition in which a person cannot produce enough or at all insulin in their body. This is an issue because insulin is necessary for the absorption of sugar in your body, which powers just about every function in your body. Now, diabetes comes in two different forms. Type 1 is a hereditary form which is passed through generation to generation due to DNA malfunctions or defects. Basically, in type 1 diabetes, a person is insulin dependent because their body does not produce enough or at all due to the beta cells not working properly. Beta cells produce insulin, and if they're not working properly, you don't have enough insulin or at all. Now, the issue with type 1 is that they are dependent on insulin, which means if their blood sugar gets too high, they have to take insulin shots to make it go down. Now, this is sort of similar with type 2, but in a different way. Now, type 2 is a condition which is brought on later in life, which is the opposite of type 1 because of the nature. If you have type 1, you're going to get it earlier because it's a DNA thing. If you have type 2, it's later because it's a lifestyle / choice thing. Now, type 2 is because people lead horrible diets. They don't exercise. And what happens is their body becomes too strained to break down massive amounts of sugar, and this way they become dependent on insulin, just like type 1. But the issue with type 2 is that they can produce insulin, but it's not enough, which means that it is preventable and possibly curable type 2. Now, the risks are as follows. With type 1 and type 2, if you have family history of that type of disease, or like if you have a lot of cholesterol, if you do not eat well and you do not exercise, those are major things that can contribute towards diabetes and getting them. Now, a couple of different things, dark armpits, dark neck, if the skin feels a bit thicker than it should, that's a risk of getting it. And just high triglycerides and overall a lot of sugar in your blood. Now, there are preventative measures, and which is a good thing with type 2 because you can actually cure them. Like I said, if you eat really well and you exercise and you basically lead a healthy lifestyle, you will prevent diabetes for the most part. But it's up to you and I to be able to spread the information to get diabetes back to where it should be. Thank you.